Hmm.
Students, today we are going to discuss uh, two important complications of peptic ulcer, that is bleeding, and another is perforation, which we have already discussed, a gastric outlet obstruction. Okay, so let's first discuss bleeding. Hematemesis and melena. When person vomits blood, we call it hematemesis, isn't it? And when the bleeding in the stool, black tarry stool occurs, then it is suggestive of melena. That is, patient is bleeding and it is upper GI bleeding, which leads to melanic stool, black soft tarry stool. Okay, so what are the causes of hematemesis melena? Most important is, you come from above, you see, causes can be in the esophagus, and which can be esophageal erosion, esophagitis, or ulceration, or esophageal carcinoma. Then lower down in the stomach, we have gastritis, gastric ulcer, duodenal ulcer, isn't it? Or gastric malignancy. They all can lead to hematemesis and melena. And so in duodenum also, any duodenal ulcer, duodenal erosions, duodenal malignancy can also lead to hematemesis melena. Apart from that, hematemesis melena can occur because of conditions when repeated vomiting and retching can lead to tear at the GE junction, esophagogastric junction, just below it. That is called Mallory-Weiss tear. And that tear can also lead to bleeding. Then another condition is Dieulafoy's lesion. Dieulafoy's lesion is basically arteriovenous malformation occurring in the stomach, and it can lead to spurt of bleeding. Okay, so these are the common causes, and of course coagulopathy and all, and trauma can also lead. So these are all causes of bleeding peptic ulcer. So if somebody comes to you with hematemesis and melena, what should we do? First, you have to resuscitate, take a proper history, examine the patient, see for pallor or any abdominal tenderness and signs, and take a proper history, then do examination, and then and in another important cause of hematemesis melena can be portal hypertension and esophageal varices also. So when you are taking history, you have to ask for history of alcoholism also, okay, and see for signs of cirrhosis of liver and all, okay. Then examine the patient, and then we we have, first thing we do is resuscitate the patient. Resuscitate the patient. Put an IV cannula in, take blood 20 ml for grouping, cross matching, CBC, LFT, and all routine blood investigations. And give patient fluid, IV fluid. If blood is needed, give blood. Okay. And usually in bleeding peptic, here we will concentrate ourselves to bleeding peptic ulcer. Other causes of hematemesis melena we will discuss later, as in when we come to esophagus we will discuss about portal hypertension and all. So let's come down to bleeding peptic ulcer. So this is what you do for bleeding peptic ulcer. Put an IV cannula, might need Rice tube, Foley's, okay, and give IV fluid, give blood if needed. Give high dose of proton pump inhibitor, PPI, usually 2 vials. 1 vial is usually 40 milligram esomeprazole. We give 80 milligram stat, then 8 milligram per hour for 24 hours or so. You can also give tranexamic acid, Trenexa. These things will, if there is a increased prothrombin time, you can add vitamin K. So these things will usually stop bleeding. If it doesn't, then we will do an upper GI endoscopy and see from where it is bleeding. These days, through endoscope also, you can inject a sclerosant agent, isn't it? Like adrenaline, noradrenaline, you can inject at the around the ulcer to stop the bleeding. You can also apply heater probe. There is other methods of taking care of the bleeding by the endoscope. One is you can use monopolar diathermy, you can use heater probe, you can use, there is a small clips, hemoclips. If blood vessels are visible, you can apply hemoclips over it. And so these are the various endoscopic methods of controlling the bleeding. And if this does not control the bleeding, then sometimes we'll have to go for operation, surgery, okay? And usually a laparotomy is done, duodenum is opened, or wherever from the bleeding, where we have known the bleeding site beforehand by endoscopy, so open there, and then we will underrun the bleeding vessel. If it is duodenal ulcer which is usually bleeding, mostly it's